Good morning, everyone. We're delighted to welcome everyone to our Silver Economy Forum, the Global Coalition on Aging. Our second day. Many of you may have tuned in virtually to our panels in Geneva, which were fantastic. We had representatives from the World Health Organization, the ITU, WSIS, many governments around the world, and of course our companies. I'd like to thank, in particular, the members of the Global Coalition on Aging who have provided particular support for Silver Economy Forum 22. Pfizer, Honor Home Instead, Gilead, Bayer, Bank of America, Merck, Deloitte, Sanofi. But in particular now with our session here, I'd like to give a special thank you to our partners at this UN event, the government of Chile. Thank you, Madam Ambassador, and we will ask you to speak in a moment and formally welcome us. And UNDESA, where's Amal? Amal, thank you very much, Amal. Great to have you. I'd like now to turn to Carolee Lee, CEO of Women's Health Matters.
Thank you, Michael, and thank you, Melissa, for this wonderful invitation. I began an organization, a 501c3 called WHAM, Women's Health Access Matters, to show what would happen economically if we were to accelerate women's health research. I did this because as a businesswoman, I understood very early on that there was a tremendous impact when women in my company, which was 85% female, were off to take care of their loved ones and or their children. And the data that I'm about to share with you is mostly U.S. data, although we're in the process of working with the RAND Corporation, with whom we worked on our original data for a global study. But I think what we need to do is just put a couple of things in perspective. At least in the U.S., women are 52% of the population, 51% of the workforce. They make 80% of the healthcare decisions, 85% of the spending decisions. And if you look globally, women drive economies. But women have been historically left out of medical research, even for diseases that differentially, exclusively, or disproportionately impact them. And this kind of medical research gap is a major obstacle not only to achieving equity in healthcare, but to advancing the health and well-being of women around the world and a healthier society. Until now, we have lacked data about the economic costs, the benefits, and the social impacts of attention to sex and gender in health research. That medical research gender is not only an obstacle, but can drive the economy. And up until now, no one had, and we're not exactly sure why, evaluated the economic consequences of what that cost would be and what the benefits would be. In 2019, I assembled a group of businesswomen to see if we could create a change. And we actually asked the RAND Corporation to study with us what could be the economic impacts of increasing investment in women's health research. We chose 4 areas to study that we knew disproportionately, exclusively, or differentially affected women. They were brain health, heart health, which we've heard about, autoimmune disease, and cancer. Let me just give you some of the top-line findings. Alzheimer's disease, as we know, costs our economy $321 billion this year. Women are 66% of the patients, 64% of the patients globally, yet only 12% of research dollars are focused specifically on women. Cardiac artery disease costs our economy over $555 billion a year and is the #1 killer of women, yet only 4% of research dollars are specifically focused on women. Rheumatoid arthritis costs the U.S. economy over $40 billion a year. Women are 70% of the patients, yet only 7% of research dollars focus specifically on women. In each of these examples, we still don't know why women are affected disproportionately, as there just isn't enough data and research, and it isn't because women live longer. It turns out, and here's some good news, that women's health research isn't just good science, it's a good investment, and yields far higher higher rates of return than general research. The report that we commissioned RAND to do finds a higher rate of return for research focused on women, driving billions of dollars to the economy through greater quality of life, workforce and economic gains, and reduced healthcare costs. This model, according to RAND, yields a very significant increase and a very significant return. In fact, $350 million yields a $14 billion return. And we were able, with Tammy Duckworth and Jan Schakowsky recently, to propose a resolution to Congress to double the budget, which is these numbers. So our new global analysis examines sex-specific differences in 5 high-income countries to provide a comparison to the US-based microsimulation model results, assessing the burden of disease by sex in these comparable high-income countries. And that's going to demonstrate where the disparities exist and where there might be opportunities for advancing research investments in women's health. Let me just say that I've heard a lot in the past couple of days about collaboration. We partner with some of the leading institutions around the world, and we are forming a PPAP, which is private-public academic partnership, which brings together policy, advocacy, business, science, academia, and anyone else, and I hope all of you. Thank you so much, Michael. I tried to do that in 3 minutes or less.
It was great. Thank you very much, and I learned a great deal.